Hi there, everybody. This is Thad from Care Message. Going to give everybody a couple of minutes to join here. Thank you so much for joining early. We will move the slides ahead shortly. Go ahead and give everybody another minute or so, and then we will get started. All right, well, we have a pretty packed agenda, so I will go ahead and kick us off here. People can obviously continue to join, and we will be sure to send out the full recording afterwards. But just wanted to give a quick thank you to all of you who have joined our presentation today. We appreciate the attendance of both our current Care Message customers, as well as those of you who are simply interested in learning more about how an FQHC in Milwaukee has leveraged their ability to communicate with their patients via text message to inform the work that they've done throughout the course of the COVID-19 pandemic. We will hear from two members of the team at the Gerald L. Ignace Indian Health Center today. Joining us is Linda Sternot, Quality Management and Improvement Coach, and Jeremiah Wayman, Director of Marketing and Communications at GLIIHC for short. My name is Thad Kalashevsky, and I am part of our customer success team here at Care Message. For those of you who are not familiar with Care Message, we are a nonprofit organization that leverages technology to help safety net organizations fulfill the essential needs of underserved populations. We do this primarily with a text message-based patient engagement platform. And ultimately, our vision is of a world where all people, regardless of income or background, achieve equitable health outcomes. FQHCs, free clinics, and other safety net organizations have delivered over 1.3 million messages and counting about the COVID-19 vaccine through our platform. So we are very excited to share this information with you. Just a few quick logistics. Please feel free to ask questions throughout the course of the presentation by clicking the Q&A button or the chat button in Zoom. We will do our best to get to everyone's questions, and feel free to pose questions to the Care Message team or to Linda and Jeremiah. We are all more than happy to chime in. If you have any questions about this presentation or Care Message in general, please reach out to Jessica Day at jday@caremessage.org. So without further ado, I will hand it over to Linda. Take it away.
Good afternoon, everyone. As Thad had introduced myself, I am Linda Sternot. I'm the QM&I manager for the Gerald Ignace Indian Health Center Quality Improvement Department, and coach staff in their efforts to improve a lot of our key performance measures. The Gerald Ignace Indian Health Center, also known as GLIIHC, is a nonprofit Title V urban Indian health center in FQHC, serving the greater Milwaukee area's urban Indian population, as well as other ethnic and racial groups in the surrounding diverse low-income community. GLIIHC services and programs focus on early intervention and prevention, routine care, excuse me, and disease management within the context of a NCQA and GLIIHC recognized patient-centered medical home. Our mission is to improve the health, peace, and well-being of urban Indians in the greater Milwaukee area. And our current patient population is around 2,500 patients. We are currently using the Indian Health Services RPMS electronic health record. Next slide. The purpose of our immunization study was to raise awareness about the importance of vaccinations to protect children and adults from potentially harmful diseases, particularly during the time of COVID-19, when reducing the impact of flu-related viruses on our healthcare systems was of paramount importance. The Center for Disease Control stated the COVID-19 pandemic caused healthcare providers to change how they operate to continue to provide essential services to patients. These efforts to reduce transmission of COVID-19, such as the stay-at-home orders and shelter-in-place orders, led to decreased use of routine preventative medical services, including immunization services. So the goal of our study was to increase 4 select immunization performance measures. The first measure was to increase the number of flu vaccines for active adult patients 18 and over by 20% by December 31st, 2020. The second goal was to increase the number of flu vaccinations for active adult patients ages 65 and over by 20% by December 31st. The third goal was to increase the number of child influenza vaccinations for youth ages 6 months to 17 by 5%. And our fourth measure was to increase the number of pneumococcal vaccinations for active adult patients 65 and over by 5% by December 31st, 2020. We predicted that the 7 strategic interventions that we identified for the study would strengthen our capacity to develop and sustain a supportive infrastructure that supports or that contributes to desired immunization health outcomes. So our first intervention was to implement the Catch Up and Get Ahead community vaccination marketing campaign in collaboration with the state of Wisconsin and Milwaukee County. The marketing director, also our information officer for our command system, posted immunization information on GLIIHC's website and social media platforms. He also uploaded support resources that were specific to our patient population, including culturally relevant information for Native American, Alaska Native patients, and also our Spanish-speaking patients. Our second intervention was to identify and remove any barriers to care. And then we also extended our clinic hours on Tuesdays and Thursdays following those stay-at-home orders. A lot of people were used to using telehealth, and so we wanted to convince our patients that it was safe for them to come in to the clinic. And while we were continuing to test for COVID-19, we also had taken the necessary protocols to protect our patients and staff. The third intervention was to ensure sufficient vaccination supplies to meet our patient demand. And we can talk a little bit more about that as we go through the slides. Our fourth intervention was to implement pre-planning and max packing at every patient visit. That's where the nursing staff, rooming staff would print out our Wisconsin immunization registry printouts and look to see what immunizations the patients were due for at the point of care. Our fifth intervention was to implement a robust reminder recall system. And the way we did that was to use Care Message to send out some important text messages and get some responses from our patients, and to also use our community health workers to contact high-risk patients and help coordinate those appointments for those patients. Our sixth and seventh interventions were to implement shared decision-making at the point of care, and also to implement our standing orders immunization policy, giving our nursing staff the authority to give immunizations. Next slide. So this slide is from the Wisconsin Department of Health Services website, and the graph demonstrates a significant decrease for all ages in immunizations during the early stages of the pandemic from March through June of 2020 compared to the state's 5-year average data. So you can see the Wisconsin governor, when he issued the stay-at-home order, that was on March 24th, and then that stay-at-home order expired on May 26th. And during that time period, you can see the number of positive COVID-19 cases had really increased as the number of immunizations decreased. Next slide.
Thank you, Thad, and thank you, Linda. So as our kind of messaging via care message started to go out, centered around the flu vaccine and trying to make people aware that we were offering the flu vaccine, that really started around the end of June with our first message was just a simple yes or no answer, or a question of, are you up to date on your vaccinations? With a 4.8% response rate, 78% said yes, 21% saying no. After that, we took a little pause, gave people time to think about it. As our supply started to come in, we decided to start, again, sending out some more messaging, asking people, do you plan to get your flu shot? That's where message 2 came in, and that was at the end of August with a response rate of 3.8%, 59% yes, 40.9% no. With that message that was sent out, we did send out to our full patient list, and we ended up getting a very high response, which did end up overloading our reception phone lines, which at the time, of course, as most of us know, we were dealing with being inundated with COVID testing appointments and calls as well. So I think, from our standpoint, or my standpoint as a director of marketing, would have been more, just a smart organization of time and really coordination between our entire staff, just so, we weren't as overloaded as we ended up being. Our message 3 went out to specifically just our native population to try and, as we experienced in message number 2 with the kind of overloading of staff, we tried to limit that message that went out in message number 3 just to our native population, which was, of course, more focused, which would allow our reception staff to be more thoughtful and careful in their responses to those patients. Also to take notes, between late September, early October, we had planned on and were planning on instituting a drive-through flu clinic, which would have been, I believe, the first week of October. It just so happened that right around that time was when Wisconsin especially was hit very hard with COVID cases, and specifically at our clinic, our testing went up from roughly around maybe 10 tests per day to we were, peaking around 30, and I think our max or our highest was about 50 tests per day. So that really kind of threw our plans for flu vaccinations and our clinic as well, or a drive-through clinic, for a loop, which then led us to messages number 4 and 5. As COVID began to calm down, we did start opening up messaging again to our patient population of 65 and older, and then following that, 55 to 65 as well. And those were, again, like as stated, much more focused messages. Each were to about a patient population of 195 patients for each of those. Next slide, please.
So this is Linda again. In regard to the immunization study results and what we learned from that study, all of our performance measures for immunizations increased during the month of September. At the end of the study, we exceeded the goal for 2 of the performance measures, the adult 18 and over influenza immunization measure and the child 6 months to 17 influenza immunization. We almost met our goal to increase the pneumococcal vaccination measure. Our goal was 55.2%, and we achieved 54.7%. The fourth measure, the influenza immunization goal for patients 65 and over, we did not meet. That goal was 63.1%, and we achieved 46.1%. And in talking with our providers, getting their feedback at the end of the study, what they thought about the measures we met, the measures we did not meet, a lot of the providers shared that the elders in the community felt safer at home. And as Jeremiah said, as we started to see an increase in COVID-19 cases during November, and calls were being made, to these elders saying, come on in and get your flu immunization, they really felt safer at home. And they were saying, well, why should I come in and get the flu vaccine? I don't really go out. People deliver my meals. They deliver my groceries. And I'm not really getting out into the public. So I really don't think I need that flu vaccine. And a lot of those elders were really waiting for the COVID-19 vaccine to be implemented. So the other issue was we had some of our vaccine supply. It really did not come in until probably late September for the non-native population. So as patients called and said they wanted to register or make an appointment for a vaccine, we did not have some of those high dose vaccines that some of the elders were looking for, and may have referred those patients to a local pharmacy or another healthcare facility where they could get the vaccine. And the way our RPMS system is set up in conjunction with the Wisconsin Immunization Registry, it's not bi-directional. So in that case, the patient could have gotten their vaccine, but we didn't have that information in our system as the patient receiving the vaccine. So that was the results of the study. What we learned from the study, we learned lots of things. I think it was a really good study. First of all, use of the care message text messaging software is really a cost-effective, efficient way to raise awareness and remind patients to catch up on important vaccines that protect individuals from preventable infectious diseases. It being that the care message system is somewhat new to some of our staff, and I'm still learning some of its functionality, we're learning more as we go along and what that system is capable of. So that's really exciting. Also, implementing pre-planning and max packing, shared decision-making at every patient visit. It's a very effective intervention that contributes to an increase in our immunization rates. And our providers have close relationships with their patients. So again, shared decision-making, talking to the patient about what do you feel comfortable with? If you're not planning on getting excuse me, the immunization, is there a reason for that? Same with COVID-19. If you're not planning on getting the vaccine, do you want to talk about that? Is there something that we can help you understand? And then another important point that we learned, patients had a greater interest, or they demonstrated a greater interest in getting that flu vaccination early in the season rather than later, when their attention kind of diverted to holidays that were coming up. How are we going to plan these Thanksgiving, Christmas parties with less people or just with family? How do we stay safe? Again, with the increase in cases, we were still providing services via telehealth at that time, and we are still providing services through the use of telehealth. So some patients really got used to that and didn't feel comfortable venturing outside of the home just to get a flu vaccine. And some of those patients, again, were just waiting for the COVID-19 vaccine to be available. And again, the flu vaccination supply, it was not predictable, and it was insufficient at times to meet our patient demand in the early part of the campaign. So we needed to adjust our campaign strategies to meet our patient demand. Next slide.
So throughout this process, we've had kind of utilized a multitude of avenues as far as our vaccine communications. As was mentioned, our COVID-19 landing page on our website was developed very early on, and that kind of shifted recently into a COVID-19 vaccine landing page, with just kind of provides just a place for information for people, not trying to necessarily force them into a decision, but just keeping them informed to allow them to make an informed decision. This also kind of led us into our YouTube videos of our provider and our CEO getting the vaccine, which, I think there was a lot of instances of this going around, whether there was politicians or other healthcare workers throughout the country. I think from us being a native health organization, it was very important, being as throughout the native community there's an apprehension, or there has been an apprehension just in general regarding vaccines or government involvement throughout. And so I think from our standpoint, it was very important to put a face to that, and especially a native face to getting the vaccine and seeing how safe it was and how comfortable it was and easy to receive it was. And so that was our purpose. And through those videos, I think we were able to reach thousands of viewers, and really opened us up to some media availabilities that probably wouldn't have come without the likes of going that route. Those really all came from what we started very early on. I think this week will be our 45th week of doing our Native Strong weekly town hall meetings, which we've been doing via Zoom and then also Facebook Live, which again, just for the same reasoning behind doing the Facebook Live vaccination videos. We've been doing this Native Strong as just a native to native conversation on, of course, beginning with updated COVID numbers within the Native community, specifically, Wisconsin, the Bemidji area. And then, of course, as this pandemic has gone on, that shifted into kind of vaccine development, vaccine availability. And, like I said, we're continuing to do that this week, 45 weeks, and really has, I think, helped us reach an audience that we normally would not have been able to. We've also, of course, utilized direct phone calls to our patients, our established patients, for whether or not do they want to receive the COVID vaccine. And then also back to the beginning, which really kind of brought us into this, our experience with Care Message was the CM Lite platform, and then shifting into the full platform. That really kind of started with, informing people that we were here to provide, testing services for our community, whether they were native or non-native. We were here providing a drive-through testing service. I'd say from the very early on, mid-March. So we were at the forefront of that in the FQHC community in Milwaukee, and I think Care Message definitely has a lot to do with our successes in that regard. Next slide, please. We have also throughout this time, obviously COVID is a major focus, but we've been able to kind of expand. And as we've learned more and learned how to utilize Care Message better, been using it for breast cancer screenings, high blood pressure, our patient lists, diabetic patients, of course, COVID-19 testing, our vaccinations. Mentioned the flu vaccine. We are, as far as the COVID vaccine, we have been, because our patient list and our supply is very limited, we have been utilizing more of a direct phone call approach. Just we're trying to, as far as with our patient population and our patient lists, and I was going to say this as what we learned, keeping those lists as far as in Care Message, keeping those patient lists as up to date and clean as possible is really very paramount in having success with this system, especially until we are brought on with the Epic system, and then we have that fully integrated system. It's really very important to keep those lists clean and up to date as possible to make sure your campaigns are as successful as you want them to be. And next slide, please. And so I've gone over a few of these before, but understanding our patient population, as I've mentioned, just the people's numbers changing, the keeping our lists as clean and updated as possible, knowing kind of relating all of that to what our staff looks like at the time, especially with COVID, and ability to manage calls or people coming into the clinic, really kind of joining all three of these, the messaging, the staffing, all together to really run a smooth ship, really is paramount from the beginning. And then also, correlating that outreach with our vaccine supply. Linda mentioned that as far as our flu vaccine, and for being a IHS facility, there were limitations on as far as having a supply of vaccinations from IHS that we could only then give to Native population, versus waiting for other supply to come in that we would be able to offer to our other patients. So it's been interesting, but I think, like I said before, the ability to utilize care message, and as Linda had stated earlier, kind of learning as we go and getting better at keeping those lists up to date, and really allowed us to kind of, I think, improve as we have gone on in the use of this system. Next slide.
Awesome. Thank you, Linda and Jeremiah, for sharing your work and all that you've been able to accomplish over a relatively short period of time with Care Message. I just wanted to quickly highlight a few additional ways that we have seen our customers leverage their ability to text their patients, with a particular focus on COVID vaccine administration. In the first example here, we see an excellent use of the yes or no outreach message type. We are accomplishing a few things here. We are conducting a survey that will be delivered at scale to the relevant patient cohort. We are informing our patients that their health center has access to a certain number of vaccine doses, that they are now eligible to receive the vaccine. And we are also creating a list of patients that we can share with our appointment scheduling team for follow-up. And as you can see, for those patients that respond to our question indicating that they are interested in the vaccine, we can automatically let them know that we will be in touch shortly, or to call our phone number with any questions. For those that indicate that they are not interested, we're letting them know that if they have any concerns about the vaccine or they change their mind, to give us a call. This would also be a great place to include a link to something like the COVID-19 landing page that the team at GLIIHC created and was referenced earlier. And even if you do not yet have access to the vaccine, you can use a similar message to create a wait list of those that are interested and reach back out once you do have vaccine doses on hand. Example number 2 is a potential follow-up message meant to be delivered to all of the patients that indicated that they are interested in receiving the vaccine. In this case, we are reaching out and asking what a good time would be for the patient, but you could always make this more specific and reference your calendar for availability. Regardless, the idea here is to follow up on an individual basis through our messenger feature after we've conducted our survey. So we are first reaching out at scale, then following up more personally. And finally, in example number 3, we see a purely educational message meant to inform your patients about the potential side effects of the vaccine and hopefully ease their fears of following up with the second dose in order to achieve full protection. This might be something that we send out at the end of each day to all of our patients that received their first dose of the COVID vaccine. Alternatively, this or something similar is something that could be sent out as a follow up to our survey in example number 1. Present those that are planning on receiving the vaccine with some information upfront on what they can expect. So, if you are a current customer of ours and you have any questions about using Care Message, please feel free to reach out to your customer success manager or myself to discuss further. And if you are not yet a Care Message customer and can see how this type of engagement with your patients might be beneficial to your organization, you can go ahead and reach out to Jessica Day at jday@caremessage.org. So we will go ahead and take the remaining time to answer any questions that you all might have. So I will go ahead and take a look at the Q&A as well as the chat. So feel free to continue to submit questions there. I did see something come through the Q&A box here from Ayinade. I apologize if I butchered your name. The question was, were you concerned about the cost of text messaging for your patients? And I'll open that up to Jeremiah and Linda, and then I can maybe expand on some things that we've seen from across our customer base. Was there any concern, Jeremiah, about the cost of text messaging, and how do you kind of reconcile that?
I think from the get-go, it had come up, but to be for I think the positives versus that very small negative, I guess for probably a very small portion of our patient population, I think the positives would have to outweigh that negative. But it did come up as a possible negative or bridge or wall that some patients may have to cross. But I think the overall positives did have to outweigh that. And with some people, that's why it's still we still are available via call or clinic if some of those people didn't want to accept or open those messages.
Yeah, I think that's a really good point, and something that Jeremiah mentioned with regard to making sure that these messages are going to the right people at the right time is something that's important here. So long as the patient is receiving a text message that feels relevant to them, I feel like they are generally, welcoming to those sorts of messages, especially from a trusted healthcare provider. Um, Generally speaking, we also have found that most folks prefer text messaging to phone calls. And even with a lot of the government issued cell phone plans, they tend to prioritize text messaging over phone call minutes, and kind of hold those phone call minutes more near and dear to them than the text messaging. So yeah, looking at the additional questions here that we have seen come through chat, it looks like Margaret is asking, was the care message system a text message or via portal? And how did it go out to patients? Yeah, care message facilitates the delivery of a text or in some cases a voice message as well. So any messages that are delivered via the care message platform are going to go out via text. Jeremiah, Linda, is there a patient portal that you direct folks to at your clinic?
This is Linda. There is not a patient portal that we use currently through the RPMS, Indian Health Services System. We've had some difficulties trying to set that up so that our patients can use that effectively. So no, currently we don't have a portal for that.
Gotcha. Yeah, it is a use case that we see relatively often, though. Folks using care message to try to promote the use of their patient portal. Providing a link to that portal is often well received via text message, as opposed to kind of the traditional method that we have seen health centers use, which is delivering that via email and asking people to sign up that way. Providing it to them in a text message with a link that they can click directly from iMessage or from their messages application kind of lowers that barrier to entry for getting signed up and actually making use of the portal. So definitely a good question and good use case that we've seen in the past.
Thad, if you don't mind jumping in, I know, we
Sure.
obviously we haven't been able to use it to direct to a patient portal, but we have been able to utilize it to direct patients to, our YouTube channel or our social media pages. And, the use of like a bit.ly, to shorten a URL or something like that, allows you to kind of save some of that character space and still be able to get, your programming out to your patient list, like you said, without having to use email.
Awesome. Thank you. Anu asks, regarding the specific list of patients, and I suppose this is a question specifically for Jeremiah, regarding the specific list of patients, how do you keep the list up to date and feed that into the care message application?
Yeah, so this is one that, we talked about a little bit throughout the presentation, but it's just a matter of, pulling that list from, whoever your person inside your organization would be, and really making sure that, your identifiers are consistent on every list that you pull. So whether that's, race, first name, last name, age, specific groups. And for us, that tends to be tribal affiliation or diagnoses, language, and also, patient identifier numbers. And so, I learned that early on, as far as mentioning, this is a kind of a learning process, just making sure all of those are consistent as you upload, as then you won't be recreating the same number or name, for a specific patient. You'll just kind of be or updating that certain patient's list. So then when you're sending out these text messages, you have a much better time, or it's easier to kind of differentiate and narrow down your focus of who these, who the messages are meant to go out to. And like I said, I think we've gotten better at doing that as we've gone on. Now being able to focus on, age groups or patient populations, tribal affiliations, diagnoses when it comes to high blood pressure or diabetes and stuff like that. So it's definitely something I've learned as I've gone on. But I think early on it was kind of just, okay, I'm just going to send this out to a bunch of people, and I don't think we had as many identifiers in there to really narrow that focus down. But as we've gone on, that's definitely changed and helped us for the better.
Thank you for that. Yeah, and as far as the logistics go for uploading that list, it's a pretty simple file upload process with an Excel spreadsheet that you are able to upload directly to the care message platform. It'll avoid creating duplicate patients by referencing the same unique identifier for each patient. And so, yeah, again, Jeremiah mentioned the creation of those groups. We're able to create certain patient cohorts that allow you to send much more targeted text messages to certain groups for certain purposes with a certain call to action. And Margaret has a follow-up question here stating, so if we have an electronic medical system that also supplies text messaging or portal messaging, then care message would essentially be a duplication of services. And if not, what do you do differently? Yeah, I think we found that a lot of the EMRs or portals are going to provide messaging around appointment reminders and things of that nature, without necessarily a high ability to customize that messaging. And I think that's what care message does particularly well, is allow you to define an objective or a goal, such as we saw Linda present on with regard to reaching out to our patients with high blood pressure or trying to book more cervical cancer screenings. We're able to segment that particular cohort and deliver a call to action via text message specifically, in order to increase the rates there. So I think the customizability is something that allows us to fill those gaps in care. Care message is also able to be integrated with an EMR in order to deliver customized appointment reminder messages as well. So I think it allows for a bit more flexibility there as well. And yes, Linda.
Yes, I was just going to add that even with the FQHCs in some of the grants that we receive, that funding to support some of our quality improvement initiatives or collaboratives that we may have with the state or with other business partners, it gives us that platform, so to speak, where we have limited staffing. And of course, our priority is patient care. And there, with COVID-19, there's changes every single day, and people are being repositioned to do different things to meet all of the demands. However, when you have certain expectations like NCQA, GLIIHC that say, if you want to demonstrate that you continue to operate as a patient-centered medical home, you're going to engage in these QI activities. And what I found is care message really serves as a nice tool to help us meet those deliverables and do that without having staff sitting behind a desk, calling people, hey, you're behind on your breast cancer screening. And so now we have a specific list of patients that we can feed into the care message system and start interacting with these patients. And also the patients can respond back to, say, for example, our diabetes management nurse and say, I'm having a little difficulty managing my A1C. Can you help me with this? We have another project coming up with uncontrolled blood pressure, patients diagnosed with hypertension, and linking them to the care message, the 20-week program, I believe that's available to them to provide some self-management support. So I think there's some different kinds of opportunities with regard to grant meeting those objectives and deliverables, and also meeting certain QI requirements.
Thank you for that, Linda. Yeah, you bring up an important point there that I failed to mention, is kind of that ability to communicate bidirectionally, where patients are able to respond to all of the messages that you send out. You're able to kind of collect that data and information and self-reported results from your patients as well, in a way that is comfortable for them. We are right up against the time limit that we set here. So I just wanted to once again thank Jeremiah and Linda for presenting today. We appreciate your time. And if there are any additional questions for either Jeremiah and Linda or for the Care Message team, please do not hesitate to reach out to myself or to Jessica. We are going to, again, send out the link to this recording. If it is something that you'd like to share with folks, please feel free to do so. And thank you so much for your time. Take care.